I think we're on. Good evening and welcome to Talking to Thursday. Here we go. It's Thursday. Where does time go? Other week. If this is the first time you join me, welcome. I am Lee. I am oral health coach at Growing Smiles. And this evening we are going to talk about sensitivity. We're getting to that time of the year, we're looking for cold drinks, and maybe I sometimes think this is more a year-round problem, because during the winter, people who suffer from fairly marked sensitivity find that they have to put a scarf around their mouths, and generally speaking, it's not much fun. But we're getting to that stage in the year now that we're looking for a cold drink and maybe some ice cream or an ice lolly. And again, are you one of those people actually go, no, I will pass? So this evening, we are going to talk about dentine hypersensitivity in particular. And it's really important when we look at sensitivity to actually recognize what actually is, where the problem's coming from, because your teeth can be sensitive for a number of reasons. And that's really important to actually remember, because it's not always just down to dentine hypersensitivity. But tomorrow is actually Gum Health Day, and one of the most common reasons for people having sensitivity is when they've got a little bit of recession. Sometimes that can occur after gum treatment. So I am going to talk about hypersensitivity, and we're going to have a little look about what it is and what you can do about it. So as you can see, if you're one of these people that finds that if you've something quite sweet or something quite cold or even hot drinks and your teeth are going, ah, you maybe have dentine hypersensitivity. But fear not, there's actually quite a lot you can do about it. So what am I actually talking about? Well, I am talking about let me move my stuff out of the way. I am talking about dentine. So it's the layer underneath your tooth. Once it gets exposed, it's the connecting link between the outside world and the nerves inside the pulp of the tooth. I'm going to do a wee bit of dental anatomy in the middle of this, just to make sure that you're all learning something as we go. So we're going to look at what it is. So, do you avoid ice cream? Do you avoid cold drinks? Dentine hypersensitivity can actually be really difficult for your dental team to diagnose, but please talk to them about it. And I think it's one of those things that we don't talk enough about in clinical practice. It's a bit like bad breath. Again, it's not always something that, you bring to attention until they blow air in your tooth and you're, my tooth is really sensitive. But it can be difficult to diagnose. If you're not sure what you want to do and you're having pain, what you want to do is try and keep track of it. Is there something that sets it off? How long does it last? Is it something that's been increasing, or is it something that's pretty short, sharp, disappears when you finished having your sip of your cold drink? So we're going to talk a wee bit about that. But sometimes when you've got, particularly if you suffer from sort of chronic sensitivity, it's quite good to actually keep a pain diary, so you can recognize what your triggers are, so you can then do something about them. So as I said, it can be quite difficult for dental professionals to diagnose. But the good news is there is actually quite a lot that can be done about dentine hypersensitivity now, and it's a stepwise approach. So what we're going to look at is basic, what you can do, from the get-go yourself, and then what you need to sort of do as a more moderate sort of standard care, and then what might be done from the point of view enhanced care. So people who've got really seriously chronic hypersensitivity, and that's a combination of what you can do at home and what your dental professionals can do for you, and you work together to actually manage the condition, because it really isn't pleasant, and it's actually huge quality of life issues. I know people who will not go out to eat or drink with friends because their teeth are just so hypersensitive. Going out in a cold day, it's just not going to happen unless they're absolutely muffled up. So as I say, we're going to have a look at it. So, the definition of dentine hypersensitivity is a short, sharp pain which starts rapidly and it stops whenever the stimulus is removed. So when you have a drink of water with ice in it, instantly sets it off. But once you stop, it goes away rapidly. So that's generally sort of the sort of short definition. It's often a chronic thing, so it goes on and you live with it, and you have fluctuating acute episodes of it, so things can get worse for a while. And again, there can be a number of reasons for that. But the bottom line is it's caused because dentine has become exposed. And dentine is the second layer of your tooth that builds up the bulk of your tooth. And if I take this little tooth here, take my DIY plaque off, there's the gum. And what I'm going to do is I'm going to split this tooth in two. So, and what we're going to do is we're going to look at the tooth that way on, so that we can actually recognize the different parts of the tooth. And you can see the enamel is the white stuff. We tend to sort of think of the tooth as the bit you see in the mouth. The enamel is a hard coating that covers the outside of the tooth. There's a material called cementum that covers the root. And then inside all of that, the bulk of the tooth is actually made up of dentine. And the dentine is made up of little tiny tubules. So we're going to look at this a little bit more. And in the center here, you can see where all the nerves and blood vessels are. And that goes out through the root and joins the rest of the nerve and blood supply in your mouth and your head. So I say we're going to have a look at this in a little bit more detail, because I think sometimes understanding how and why something's happened sometimes gives you a bit of motivation to do something about it. And sometimes that can be changing a habit you don't really want to change, that you know how you're eating or drinking. So if you're sipping something like a diet drink all day long, it might be the motivation because you know what's causing it, to actually cut that out or cut it down to meal times only. So the bottom line is, for dentine hypersensitivity, the dentine has to be exposed. So that's the bit of your tooth that tells your brain there's something not right, that there's pain going on here. So this is my tooth. Do you remember? I've just taken this tooth apart. It's very classically the picture that we always show people of teeth, and it's not the way we see teeth in this cross section. So that's the tooth, looks like that. And what we've done is we've just taken half it apart. So we split it down the middle, and what we're doing is we're looking at this tooth as it's actually cut in half. So that's where the gum line is. So what you have here is you can see the gum, and underneath the gum, that's the bone. And then this is the enamel that covers the crown of the tooth. It's the hardest substance in the body. And you can see where that dovetails into the root of the tooth there. It's really, really thin. And then you've got the gum tissue that comes up with the little cuff just at the neck of your teeth. So if you actually poke at the neck of your teeth, you will feel there's a little lip there. There's a little cuff there. It's a bit like your cuticle. It's that little cuff just as where your nail goes into your nail bed there. There's a little cuff there. And that actually protects that connection between the crown and the root of the tooth. And the root is covered by a very, very thin substance called cementum, which is very easily worn. But we're going to have a look at this anatomy, because most of us sort of think of the tooth, the bit that we see in the mouth. And it's a bit like the swan thing, you know. So you've got the crown of the tooth, but actually all the action's going on underneath. So underneath the crown, underneath the enamel, you have got all this dentine, which is a live subject with then the pulp in the middle of it, where the nerves and blood vessels are. And the connecting factor to the outside world, outside of the enamel, once the enamel gets broken down, the dentine is exposed, and you're going to get some sensitivity. Because that is what tells the nerve of the tooth that there's something going on, and it's the messenger, if you want to look at it like that. So here we go. This is a little bit about what can happen that can expose dentine. And probably the most common thing we think of with teeth getting sore is tooth decay. So here you've got a nice bit of yucky tooth decay going on there. And as that actually develops and goes down and breaks down the enamel, so it dissolves the enamel, so it can break down the enamel. And then as it progresses, it gets into the dentine. And because the dentine is much softer, it will progress much more rapidly. So it can progress quite quickly through dentine. The further it gets through dentine, the closer it gets to the heart of the tooth, the more pain you're going to have. is tooth decay. Likewise, if you've got wear, acid erosion on your tooth, the outside tooth surface gets dissolved through acid erosion. You don't get decay because you don't have the bacteria involved actually creating decay. So it's slightly different mechanism, but still the acid from acids in your mouth, so it might be gastric reflux, it might be something you eat or drink, can erode the tooth surface and can erode it through to the enamel, to the dentine. And again, then you're going to start to feel it, because once the dentine is exposed, you're connecting to the heart of the tooth where the nerves and the blood vessels are. So one of the most common reasons, and by and large, this is really what we're going to come down to tonight, is going to be what happens when you get a little bit of recession. So this is the gum tissue here. So back to our tooth. Take our tooth, that's our gum. Put my gum back. Put my gum back in my tooth. Around my tooth. That is what we're looking at in this picture. So I'm going to take the gum away. And then I'm going to split that tooth in half. And what you're looking at is what I have here. Now, the gum tissue starts to recede. Now, there's a whole lot of reasons why you get some gum recession, but the most common is gum disease. And the gums start to recede, and as that recedes, the crown of the tooth, remember when I said about this tailor and getting very, very thin at the neck of the tooth where it connects to the root of the tooth, very thin and get worn very easily. The root surface and the dentine is exposed because you don't have that same thick, hard covering on the root surface. So you get an exposed dentine as the gum recedes, and that's the bit that will then become sensitive. So one of the most common side effects of gum treatment is actually that you've got some recession, but it's totally manageable. So let's have a closer up look again. This is the dentine here. So you've got your enamel on the crown. It's the hardest substance in your body, harder than bone. So, it's not easily worn away. And then the bulk of the tooth is made up of the dentine. And if you took a little bit of that, you can see all these little holes. These are little tubules that actually connect from the outside dentine. You see all the little lines there, those tubules, into where this is the pulp chamber where the nerves and blood vessels live. And again, let's look at an even bigger term. So again, we're back to my tooth. You've split it down the middle here, and we're going to take one small section just at the gum where the neck of the tooth joins into the root of the tooth. And you can see how thin that enamel is there. Now, if we enlarge that, you can see there's the gum tissue there, just to orientate you. This is the exposed dentine at the neck of the tooth because there's been a wee bit of recession. And what's happened is this root surface, which is made of a dentine, has become exposed. Now, what you have, the little tubules, do you remember I showed you a minute ago? These are the little tubules on the outside. And it sends down through these little tubules, which are fluid filled. It sends messages in there that says, oh, this is sore, where the nerves and the blood vessels are. And the nerve then tells your brain that goes, oh my goodness me, this is sore. And you go, oh, usually. Okay, you might say worse things than that, but that is basically how it goes. And there's a number of theories how dentine hypersensitivity actually works. But the most common one is still what we call hydrodynamic theory. But don't get bogged down with that. You can go and read about it if you really want to. I can send you links if you so wish. But what you basically get in this scenario is you get an external stimulus here at the enamel at the dentine. I'm just picking cold for the sake of it because it is the most common one. That message is fired down those tubules to the nerve and it goes, ouch. And that's how basically dentine hypersensitivity actually works. So I just want to move that out of my way. And the bottom line is the dentine has feelings. Now, back to the thing I was saying to you about tooth decay there. So when you get tooth decay developing, and the most common places for decay is in the crinkly bits that you bite on because they're hard to keep clean and bacteria can lodge in there. Sugar gets lodged in there, and basically the sugar feeds bacteria that cause decay. They actually then create acids, so it's sugar acids that then start to melt the tooth. and they start to break down the enamel. And what's interesting here, you can see how much slower it breaks down the enamel compared to the dentine. So once it gets through the enamel, which is the hardest substance in your body, so it does not happen overnight. Once it gets through the enamel, then all of a sudden it can undercut and undermine in the dentine because it's so much softer. And it just keeps going until it gets into the pulp. Once it gets into the pulp, that becomes infected, and that's where you actually end up with really severe pain. And you will know about it hopefully long before then. Biting surface, the other place that's most common for decay is in between your teeth. And this is one of the reasons why your dental team take radiographs, take x-rays, because they are looking at the area that they can't necessarily always see terribly clearly with the naked eye. So it gives them an indication. So it's another piece of information in their formulating a treatment plan for you as to what is causing the problem, and then it helps them actually work out what they're going to do with it, because this can actually not only go, it doesn't go just straight in there, it can go right the way down here and underneath the gum margin, which can make it quite difficult to actually restore. But your dentine is the connection point from the enamel, which is pretty much non-filling, to your pulp, which is very, very filling, and your dentine and your dentinal tubules are the connecting factor there. So you can see here just a bit more enlarged, you can see how that decay progresses. And, you know, it's once it gets near the heart of the tooth, it can get quite nasty quite quickly. And if you look here, just out of interest, can you see these little pointy bits here, the way this, or these are what are called pulp horns. So you can see how decay in the side of the tooth can keep progressing quite quickly to involve the pulp, and then you're into a different sort of deep treatment. If it's still in the dentine, very easy to restore, very straightforward. Once it gets into the pulp of the tooth, that's when you're talking much more complex treatment, root canal treatment, that sort of thing. So I say, if you're getting sensitivity, you want to try and identify what the cause is and do something about it long before it gets to this point, where it can cause quite nasty infection, and that's where you end up with an abscess, something like that. And again, as I say, different ballpark, and even with an abscess, you still have to resolve the problem in the tooth. So first thing you've got to do, if you've got dentine sensitivity, is work out, why is your tooth sensitive? Is it dentine hypersensitivity, or is the sensitivity coming from somewhere else? You know, what actually is causing this sensitivity? So let's have a little look at that. First thing, have you just had dental treatment? Good place to start, because if you've had a filling, it might take a little while for a new filling to settle down, particularly if you've had a deep filling, because the pulp has become, maybe the tooth tissue has become inflamed, and it will take time to settle. As the tooth fillings are bonded into the actual tooth again, you've just worked around it. So if you've just had say a boil lapsed in your leg, it's not instantly perfect. It takes time to heal. So likewise, your teeth take time to recover after dental treatment. If you've had gum treatment, and most of this stuff is done under local anesthetic, so you'll be numb. So as the numbness wears off, you may feel a bit tender, it may feel a bit uncomfortable. Some people get none of it, some people get a huge amount of it. So it's really difficult to predict. We're all different. We all have our different levels of tolerance. Hopefully your dental team will have given you some post-operative instructions. So either to take your usual form of pain relief, to report after, if it's still tender after X number of days. So, you know, if you've had a filling that you're biting on, that can take a little while to settle in. It may be associated with something, if you've been tooth whitening. So if you've been bleaching, so you've got bleaching trays and your teeth have become really hypersensitive. Now, I know people who have spent a big investment, a lot of money on having bleaching trays made. They've used them once and they have never used them again because their teeth got so sensitive. And what I find so heartbreaking about that is they didn't go back and tell their dental team, because the first thing your dental team will do is either change the type of gel or tell you how to use it slightly differently. And or say, give yourself a break. If you're using it for an hour a day, use it every other day, or if it's an overnight treatment, use it every other night. They will give you mechanisms to do that. Likewise, they can give you either toothpastes or other topical paste to actually help manage that sensitivity. So there are ways and means. Really, really important to you actually talk to your dental team if you've got sensitivity. If you've had gum treatment, as that gum shrinks down, which is the way you would want it to after treatment, because it's been very inflamed, as that shrinks down, in a little bit of root surface becomes exposed, which is the way you want it, because then the gum pocket is reduced. But that little area at the neck of the tooth can become quite sensitive. But again, there's things we can do to help manage it. So don't suffer in silence. Speak to your dental team, because they will be able to guide you. But the first thing is, have you had dental treatment recently? Really, really important to know. If you've had dental treatment, what can you actually do about it? So let me think, where am I? 1 wee second, because I've lost my place, which is not unlike me. Let's face facts. Now, this is really what I'm coming down to tonight, is recession. So when you've got a little bit of recession, what has that been caused by? Has it been caused through gum disease and receding gums? Has it been an age thing? Getting older, getting a bit long in the tooth? Has it been due to traumatic toothbrushing? And this is a bit of a grey area as far as dentistry is concerned, as far as scientific evidence, whether toothbrushing in itself causes gum recession, aggressive toothbrushing. There's certainly something in it. Some people have very, very thin gum tissue over certain teeth. So what you will often see is a localized bit of recession, particularly maybe at canines or on the premolars that maybe sit out at the corners of your mouth. And if you are scrubbing like Billy-O, particularly if you're using a hard toothbrush, an abrasive toothpaste, or worse still, a tooth powder, you may well actually scrub and actually damage that really thin tissue that is sort of that stretch point over those corner teeth, and cause some recession. So there is definitely something in it. But I say the evidence is a wee bit woolly. But you can see where actually this has actually got to the point that there's a little bit of wear at the necks of the teeth there, and you get these little scooped areas, so that if you actually poke your finger, you can actually feel a dip there. And some of those can become very marked. And when the dentine is exposed, number one, you might get some sensitivity to it. Depends how long or how quickly it's happened, because some people don't get any sensitivity with it. But what you might find then over a period of time, that you can actually wear, because the sensitivity, because the dentine is so much soft in the enamel of the crown, you can actually wear that area at the neck of the tooth into almost this sort of like cave-like shape. And that then can become a problem, because I mean, I have seen people who have got toothbrush abrasion at the necks of their teeth, and it literally is, it's just making their teeth almost like an hourglass, because it's so dipped. So be very aware of that. So, you know, you may just need to look at what you're doing. Is your home care habits actually having a negative impact on your oral health? So I say it's a bit of a grey area. There's no direct relationship as to whether it causes, but, you know, we talk about non-decay lesions at the neck of your teeth. But I say we're not 100% sure, but it certainly does, just anecdotally, appear to be something in that wear. But in it and of itself, toothbrushing should not and does not cause cavities at the neck of your teeth. Tooth decay and root decay, on the other hand, will definitely expose dentine if it's left to progress. And if you listen to me on other occasions when I have talked about minimal intervention and actually nipping early decay in the bud. So when you see a white spot in your tooth, particularly in small children, see if you see white spot lesions and it hasn't actually cavitated, so it hasn't actually created a hole, those surfaces are healable. You can heal early decay. But the catch is once it's cavitated, and this is one of the reasons why your dental team want to take x-rays, because while this doesn't look so big here, you can actually see it's actually quite a big hole. in underneath that. And that's where, do you remember I showed you the image, whereas the decay through the enamel was really narrow. Once it got into the dentine, all of a sudden it actually billows out because the dentine is so much softer. And when the dentist then is actually trying to get access to that, they have to take away all that, what they call undermined dentine, because it's just these little prisms are just all hanging there, and they'd fracture off if they didn't take that back to clean it. And then dentists are now, and your dental team are much more conservative in how much healthy tooth structure they will ever remove to actually restore a tooth. There was a time they used to have to create a big locking mechanism because the only material they were using was gold or amalgam, so the silver fillings, and because once that was hardened, if it didn't have a lock and key, it would have dropped out. Now with modern materials, which I always joke about it being lick and stick, but it's not quite, but they have these bonding materials that literally, they're adhesive, they stick in there, so they can be much more conservative. They literally just remove that bit of decay, and then they can pack that material in and basically stick it in, and that seal is the bit that's really important for them when they're finished. And that's often now why you may find you get what they call rubber dams, so they get this sheet of rubber which looks as if it's hanging out over your mouth, because some of these materials are very sensitive to moisture, and that actually helps them create an environment that's going to let them do the best job possible in restoring your tooth. So tooth decay, and not only tooth decay, but root decay, that can be a cause of hypersensitivity. So again, it's exposing the tooth surface, it's exposing the dentine at the neck of your teeth. And if your mouth is dry, you have frequent sugar attacks in your teeth, you will get decay. Those are some of the things, not using the fruit good fluoride toothpaste, those are the things that actually will increase your risk of tooth decay. So tooth decay, root decay can be problematic, and the dentine will be sensitive. Fractures, so have you broken a tooth, broken a filling? If you cracked a tooth, again, dentine is exposed. When dentine is exposed, you're going to feel it. Hopefully not. I mean, this is a really, really nasty break here. That's a really nasty fracture. But those sorts of accidents, kids, things like that happen. They come off bicycles, they have accidents with contact sports. And while we can wear mouth guards and all the rest of it, it's sometimes the simplest silliness that actually can break teeth. So, there's some things, and they are just accidents, but, if you've had a fracture, something like that, you definitely want to speak to your dental team. If you've lost a filling, again, dentine is exposed. Dentine becomes sensitive because the dentine that was over that, or the cusp in that point, looks actually, the corner of the cusp is actually fractured off. So you can see these, there are 4 cusps and then a big filling in there. This becomes weakened and then it shears off. You've bitten on something hard and half the tooth comes away. All of a sudden the dentine is exposed, and that and will be very sensitive. And during the pandemic, this is an awful lot of why people were doing the temporary filling materials that nobody could get enough of, basically to try and actually manage their sensitivity until dentistry started again. Decay like this in between teeth, again, dentine's exposed, all of a sudden you're going to get sensitivity. So, don't always assume it's just a little bit of dentine hypersensitivity. Make sure you know what the cause is, and that's the big thing. Identify what the cause is, then you can work out how to manage it. Tooth wear, we are seeing more and more tooth wear. Gastric reflux with acids, it's not got the decay causing bacteria which require sugars to actually ferment and create decay acid that actually causes tooth decay. This is non-sugar related acid attack, and that can be something you eat, it can be something you drink, it can be gastric reflux, so acids coming out of your stomach. The stomach contents are a bit like battery acid. It's really, really acidic, and you can see these wear facets in the back of people's teeth in and around here, and that's acid erosion, and your teeth will be really sensitive. This is a combination, it's the acid erosion combination with tooth wear, so it's erosion and attrition. So the enamel softened, and then it's rubbed on, whether it be grinding, or whether it be brushing. If you brush immediately after an acid attack, you're going to wear that tooth surface because it's softened through the acid attack. So it takes time for your saliva to remineralize and harden that after an acid attack. So you definitely do not want to go brushing your teeth immediately after any sort of acid attack, and that can be a drink, a food, condiments, gastric reflux. And that's one of the reasons why it's so important, if you have reflux, speak to your doctor, because it's very successfully treated and managed. But again, something you need to identify: where's the acid coming from? What symptoms are you getting? I often see with young people early signs of acid erosion. So I'll often say to young people, when you bite into something cold, would your front teeth tingle? Because a very early development of acid erosion can be really, really difficult to pinpoint. But if they're getting any sort of tingling there, you're starting to get a little bit aware of that possibly early acid erosion is going on here. Because once the tooth surface is worn, really difficult to actually build that up successfully, because it tends to happen over a gradual period of time. Can be done, but it's a bit more complex to do. So it's always better to nip it in the bud. So if I get somebody that's got a bit of sensitivity and suspicious of acid erosion, I'll always ask them to keep a diet diary for 3 or 4 days, including a weekend, and actually write down what they're putting in their mouth, when they're putting in. And that can include supplements and, you know, things like vitamins and mineral supplements. So you want to know everything that goes into the mouth. If your dental team have asked you to do a diet diary, it's to help you. It's not a test. The more information they get, the better able they are to actually focus the advice for you personally, because we're all different. Makes us all interesting. And again, there's a case of acid erosion, really shiny enamel, this really, really glossy looking enamel. It can look lovely, but it's actually acid erosion. It's eroding the tooth surface. Here it's on the inside. So again, gastric reflux, people who have suffered from eating disorders, bulimia in particular, will often have really, really marked acid erosion that affects the inside of their upper anterior teeth. Gastric reflux, whatever the reason the gastric contents come up, it will erode the tooth surface. And then conversely, then you have the acids come from the outside in. So you sort of get you a bit both ways if you're not careful. And you can see the wear here on these should be pointy cusps of the enamel, but they have got worn down. So back to dentine hypersensitivity. So we've excluded the other things that it's not decay, it's not tooth wear, you know, acid erosion from, you know, drinks or gastric reflux, it's not toothbrush abrasion. And what we're talking about is dentine hypersensitivity, generally related to some sort of gum recession. And it's a short, sharp pain from these exposed dentine tubules, those little tubules. And that happens in response to some sort of stimulus, so it's often a cold drink. And that can't be put down to any other form of dental condition, disease or condition. So sometimes it's a bit of diagnosis by exclusion, but that's okay, as long as you get there in the end. So it's sharp, sudden onset to some sort of stimuli, and it is also relieved once that stimuli is removed. So. And what you must remember is dentine hypersensitivity can be managed and controlled, and it can be managed very well if you know what to do about it. And as I say, we're going to talk through a stepwise approach to that. Is it the result of traumatic toothbrushing? Have you been scrubbing away? Have you decided you wanted your teeth whiter, and you've seen something on the internet that says use a charcoal toothbrush and this powder, and you're scrubbing like mad, and yes, you're getting stains off, but you're also going to be wearing the tooth surface. So the combination of an abrasive toothpaste and a hard toothbrush, and that action that you're putting a lot of pressure on, will actually result in that traumatic dentine exposure, and that can get really sensitive. And often you can see it, as I say, on the corners of your mouth. So if you have a look, you can see sort of maybe in your eye teeth, just particularly if you're right-handed, you'll often see it on the left sort of this corner of your right hand, because that's where you tend to put more pressure. So you see it in certain places, and often your dental team will be able to tell if you're right or left-handed by that. But you want to certainly modify your toothbrushing technique, what you're using and how you're using it. As I say, there's no direct evidence that toothbrushing is the sole factor of gingival recession, but it definitely comes into play there. And sometimes it's actually helped just by changing the type of brush or changing to an electric toothbrush. So what you want to do is look at what your triggers are. It is incredibly common to get dentine hypersensitivity. And sometimes they say you can get it one off, or you can end up with a chronic condition. It can affect anywhere from about, I mean, the studies vary widely. It affects anywhere from 4 to 74% of the population, which is pretty much nearly all of us at some point. So look at the things that actually set your sensitivity off. And where you've got exposed dentine tubules that allows that fluid to move up, sending messages to the pulp, the nerve of the tooth, that then tells your brain that this is sore. Thermal stimuli is probably one of the most common. It's most likely, to be honest, it's often cold more so than hot, but also cold air that can set people off. So you don't want to maybe consider a skiing holiday if you have got quite severe dentine hypersensitivity. Tactile stimuli can also be a problem. So again, that's the toothbrushing. And sometimes people who are using electric toothbrush can find that that actually will affect one or two sites. And I say that's where most electric toothbrushes have power settings, and you always start with the lowest setting and then work your way up, because your mouth needs to get used to that. You might find cutlery, so metal cutlery, what I used to call that electric shock sort of type thing, that galvanic shock type thing, of a metal touching that dentine, because that's your tactile stimuli, which then can actually set things off. Likewise, you can maybe find if you've got an appliance, like an orthodontic appliance that's got metal bits on it, or a denture that's got little metal clasps, that can trigger. And again, then you avoid it, and then that actually causes more plaque retention, causes inflammation. So, you know, you've got to look at in the whole complex environment of your mouth, so you're looking after your whole mouth really, really well. You then have things like evaporation, so dehydration. So if your mouth gets really dry, imagine, you know, when the dentist actually, or your dental team, blow air on the tooth that makes really dry, dehydrates the tooth, and all of a sudden go, don't like this at all. That again can actually exacerbate dentine hypersensitivity. And then what we talk of osmotic stimuli. So osmosis, if you want to go back to your biology books, but basically things like sugary food and drink, where you get this change in pressure in the tubules through the membranes. And what that does is then actually trigger sensitivity. And the other one we've already mentioned is chemicals. So acids in food, drink, condiments, you know, or gastric reflux. And I say, please avoid brushing straight after any sort of acidic challenge, whether it be drink. And that's things like alcohol, popped wine, you know, ketchups, pickles, not just those things that you think of sort of fizzy drinks. Fruit teas, people don't often think of fruit waters. So sparkling fruit waters can also be acidic challenges. So it's not just your real acidic sweets, things like that can set them off. So this is the basic step to basically avoid dentine hypersensitivity. So this is a basic level of care. So what is the deal with sensitive teeth? So first thing you want to do is identify the cause and address that cause. Now that might be through your dental team, it might be through your GP, it might be a combination of both. But what you want to do is identify where is it coming from. Then what you want to do is look at what your routine is. So what's your diet like? Are you eating? Are you sitting with a fizzy, sugar-free drink all day that you're sipping constantly? You know, that is going to cause problems. What you want to try and do is keep your eating activities to 3, maximum 4 a day. And as we always say, keep sugary food and acidic foods to meal times only, and avoid them the hour before bedtime. rule applies the same way as it does for tooth decay and acid. You want to limit the acid attack so that your teeth have time to recover in between. Good high fluoride toothpaste. Now you can buy over-the-counter fluoride toothpaste with up to 1450 parts per million of fluoride in them. And I say that's what you want to be doing if you've got dentine hypersensitivity. You want to use a soft toothbrush. So softest toothbrush we have let's see if I can put my hand on one. We have a number of them, but we have what do you call it? A special care, a TP special care brush, which is extremely soft. There we go. You have it in here somewhere. So we've got the TP special care, and we have, this is the Curaprox Velvet. Now what's nice about the Velvet one, it's got quite a large surface area, but really, really super soft bristles. So really, really good to think if you have got, particularly if you've got wear at the necks of your teeth and you think it's relating to your toothbrushing habits, use a really super soft toothbrush. It's the frictional movement that you actually use to break up the biofilm. It doesn't need to be hard. It's a bit like taking sandpaper to your skin. It doesn't clean your skin any better. It just actually makes it really raw and sore. You know, or the analogy I used to always like was a rubber, but nobody uses pencils and rubbers anymore. And if you rub really hard to rub pencil out, you'll actually tear the paper. Whereas you rub gently, you get the pencil mark removed without doing the damage. So that's sort of always my analogy as far as using a soft toothbrush goes. That'll also save, particularly if you've got that really thin gum tissue. It will also reduce the risk of you actually wearing at that area as well. Chewing gum really from the point of view of stimulating the saliva flow, because your saliva is the source for calcium phosphate to remineralize and harden surfaces. So, you know, use a soft toothbrush, look at your diet, where's the triggers coming from, and high fluoride toothpaste, which has got a low abrasiveness. You're not sure how abrasive your toothpastes are. If you stick to any of the big brands, you will probably be pretty safe because it's graded from 0, which is as hard as water, through to about 200. And we have a table on the website on the toothpaste page of the toothpaste. So if you go to the tips, if you click on toothpaste, you will see what we call a RDA, so a relative dentine abrasiveness chart, and you will see the majority of big brand toothpaste of just how abrasive they are. Things like charcoal toothpaste will be more abrasive. Many of them have been reformulated. Likewise, don't be fooled because the baking powder, Arm & Hammer baking powder, has been reformulated for years to have a low abrasiveness, really, really safe to use. Things like tooth powders, don't be using salt, don't be using coal. I have heard all sorts of things used over the years, and I think the bigger the particle, the more damage it's going to do. So bit of common sense. Sometimes it's not all that common, and sometimes our short-term need to have cleaner, brighter teeth doesn't always rationalize out as what's best for us. So next step up then, so that's your basic level to avoid and prevent basic dentine hypersensitivity. If you've got gum problems, address them. So effective toothbrushing without doing any harm. Interdental brushes, if you're finding those are quite tender, go for the super soft ones, because again, TP do an extra soft interdental brush, which is considerably softer, and the bristles are longer. And I actually more and more are finding I'm getting more and more people using that. And if I can move this around a little bit, see if I can get this. Let's let me come out of this a little second before I come back onto that, but bear with me one more minute. See if I can do this. So excuse me as I pull things out of the way, but you can see here, this is the super soft bristles compared to the regular bristles, and these are much, much softer. Likewise, when I take this brush, which is really, really super soft, compared to, I'm just taking a bamboo brush, but you can see just that is much firmer compared to this lovely super soft brush. They say, look at your brushes. A hard brush is going to do more wear. And as I say, a bit of common sense in there, but common sense is not always that common. So let me switch back into where I am. Let me go back to where I was. There we go. There we are, back to where I am. So, right, I don't really need to know that. Obviously, sometimes these things like to tell me all about what's going on in the background. So, oh, no, I've lost where I was. So we're now on to standard care. So we're looking at, right, what's the deal with sensitive teeth? I have sensitivity and it is driving me round a twist. What is your next step up? Your next step up is then going to be over-the-counter things that are going to address it. So a sensitive toothpaste is really what I'm talking about there. And what the aim of any of these sensitivity treatment is one or two different ways of actually breaking up that signal from the outside world, the heart of the tooth, the pulp of the tooth, the nerves in the tooth. So it's breaking that connection. So sometimes they block the pain signals, sometimes it's just to cover the exposed dentinal tubules and desensitizing the nerve endings in the dentinal tubules. And as I say, some of these work a bit in combination, some of them work as one particular type. So this is why it's quite important. If one thing's not working for you, try a different brand, a different formulation. You want to use this routinely, night and morning, spit the toothpaste out, don't rinse out afterwards, use it with a soft toothbrush. And if you have got one or two areas that are very localized sensitive, particularly if you've had something like gum treatment, you've got one or two areas that are going to be tender, blob in your finger, rub it around, rub it in. You can do that 3 or 4 times in the day. But again, all these brands, highly recognized, different formulations, and it is courses and horses. If you stop using it, the chances are your sensitivity is going to come back, because what you've done is you're back to exposing the tubules to the outside world, whereas this is constantly just topping up the tubules and protecting them. So as I say, sensitive toothpaste is long-term use, but there's loads of them over the counter. And if you've tried one thing that's not working for me, don't dismiss them all, because different brands have different formulations. And if you've tried one that didn't work for you, try another one. You may find your dental team has samples, and that's a great way of working out what's best for you. I have people swear by one brand. I have colleagues that swear by one brand. I swear by another brand, and it's a matter of a stepwise approach. Try one thing, working for you, stick with it. If it stops working for you, try something else. So there are a number of self-applied agents that you can actually use really effectively. Some of them use bioactive glass. I mean, there's a whole different range of things that you can use. Fluoride in itself will help to harden the surface and protect. So, it's a remineralizing agent just on its own. Then it's used often in combination in sensitive toothpaste formulations to get the added benefits. So again, spit, don't rinse to get the maximum bang for your buck. This is now into the enhanced care. So you've chronic sensitivity, you find you've got fluctuations. What else can you use? You've tried each stepwise, you've got to this point and you're going, I'm still not getting on top of this. This is still causing me problems, big impact on my lifestyle. And, you want to get it under control. Human nature, we want to be comfortable. So again, there's toothpaste that you can step up to. So the likes of Biomin. So Biomin, in particular, very low level of fluoride, but very long-term benefit. So can act up to about 12 hours. And they describe it as armor for teeth. And my experience of Biomin over the last, I think, 5 years, I've been recommending Biomin for quite a long time now, this is my next step up with anybody that's chronic sensitivity. Go for Biomin. Other things, treatment paste, so things like tooth mousse and MI Paste Plus. So tooth mousse is calcium phosphate basically in a tube, which is what your teeth are made of. Great for anybody with high decay rate, dry mouth, increased risk of decay, sensitivity. If you are bleaching your teeth and you've got hypersensitivity, I always say alternate and use it. Sensitive toothpaste just as standard when you're bleaching, but if you've got one or two teeth, these are your go-to. Blob in your finger, rub it in. And the thing about tooth mousse is it's tacky. It's not like toothpaste. So it's a different, you think of it as moisturizer for teeth. That's the easiest way of doing it. And just rub it in, leave it. If you've got bleaching trays or retainers, great way of getting a topical treatment overnight, or when you finish bleaching. Very effective. You can put it on with a cotton bud, you can put it on with your finger, clean finger preferably. You can put it in trays. The other thing you might want to add in is a mouth rinse. And generally speaking, if you're looking at a fluoride mouth rinse, alcohol-free, and if you're looking at it from the point of view of sensitivity or high decay risk, you want to keep your mouth in a healthy environment in much of the day as possible. So what you want to do is use it at a different time of the day, unless your dental team has advised you specifically to do it otherwise. There are other products out there. You've got the likes of the Dr. Heft's mints, which are xylitol, and great product to suck. And again, it's all about remineralizing. Dr. Jones Sweets, erythritol and xylitol, chewing gum. So we have Choosy, which is a plastic-free chewing gum with xylitol. Mintastic's the same, so we have a number of products. If you find them on the website, they're there because we know with experience of these working. So if you're not sure, either book a coaching session or use the live chat function, where ultimately we're here to help. Like I say, get the maximum out of whatever you're using. So as well as that enhanced care, you may well actually get professional support to go with that. So this is what you're doing at home, plus what can be done in a dental surgery for you. So they may decide that you would benefit from a prescription-only high fluoride toothpaste, often used for people who are having cancer treatment or high decay risk for a variety of reasons, particularly severe dry mouth problems and older problems, people maybe who are struggling a wee bit with their oral hygiene, that, and then they're struggling with their clearing food from their mouths, and maybe your digestive biscuits lying around the teeth for a long time. Root surface exposure, you've got decay before you know it. So enhanced care plus that professional support. And that's done, first of all, recognizing as your mouth very acidic. So looking at things like what is acidic, and there's disclosing agents now that show different levels. So the old plaque, new plaque, they also show acidic plaque. And the chances are your dental team, your dental hygienist, particularly if they're doing something like guided biofilm therapy, will be using this tri-plaque gel. There are mechanisms for actually testing the pH of your saliva. Again, you might have a very acidic saliva. And again, that's not doing you any favors as far as your sensitivity goes. There's lots of topical applications. So they might use these in trays. They might use varnishes. There's specific treatments for dentine hypersensitivity. Again, it's creating that barrier, it's sealing the tubules, it's breaking the connection between the outside world and the nerve in the center of your tooth. And that's the bit that's important. So really important to address that. If it's a cavity, so you've got decay, and you might need a filling, or still you might need a root canal treatment. All else fails, you might need to lose the tooth. So if you've got a cracked tooth, for instance, incredibly hard to manage, and the only option may well be extraction. But hopefully not. As I say, talk to your dental team. Really important you communicate with them, because they will know how to advise you. So this is a bit of information from the British Society of Periodontology. Because it's Gum Health Day tomorrow, I sort of have had that sort of recession, hypersensitivity theme going all week. So you can see where we're coming from. So look at things that are erosive, look at the high fluoride toothpaste, look at the relative dentine abrasiveness of your toothpaste, and look and see what you can modify or change. Can you change the toothbrush head to a softer head? Can you change your toothbrushing technique? Sometimes that can be as simple as switching hands, or instead of using a toothbrush to clean your teeth, go for solo toothbrushing. So that's where, you literally use a single tufted brush and you literally brush like this. And do it really nicely in front of the TV, mind your own business, and then you put toothpaste on or toothmousse paste on afterwards. I'm not you're remineralizing. But when you're holding your toothbrush in a pen grasp, as opposed to a palm grasp, even if it's an ordinary toothbrush, if you actually switch how you hold your toothbrush, you'll actually put a lot less pressure on that than you will when you're going like that. And part of that is that habit formation of change and routine, so you actually are not likely to do the same amount of harm. Sugar-free chewing gum, make sure they're sugar-free. Avoid the fruit flavored chewing gums because they're actually quite acidic. But your Wrigley's, look for the tooth in the corner. That is your hint that there's something good in there and it's good for teeth. You've got Peppersmith, you've got Tuesday, which is actually the plastic-free option. We've got a number of sugar-free xylitol mints, which again can be utilized. Switch the head in your toothbrush to a soft head. Don't go brushing your teeth immediately after you've had some sort of acid attack. Now, I'm going to actually put this up in formation, but this is a nice leaflet that is a new leaflet from the British Society of Periodontology. So basically the gum guys, the gum experts, gum guys and girls, and let's not upset anybody, about managing sensitive teeth. It's got quite a lot of information there. It's really useful to actually see what's going on and what you can actually do about it. But I say hypersensitivity is very common. The important thing is what you're going to do about it. And ultimately, if you've got a question, we're here to help. And hopefully you will have found, something that'll work for you. And I say, don't give up just because you've got sensitive, you have to live with it. You don't have to live with it. There are ways and means of actually managing sensitivity. The important thing is that actually you talk to people about it. And I say, first of all, you want to identify, why are my teeth sensitive? Once you've identified the cause, then you can actually look at what you need to do to control it and manage it. Is it the fact that you've got a cavity that needs to be filled? Is it the fact that you've broken a tooth? Is it, tooth surface loss from the point of view of wearing your teeth or scrubbing your teeth? What has caused this dentine hypersensitivity? Because that then directs how you're going to manage it and control it. So say, if you're not sure, if you do not know what you're looking at, please contact us. We're easily found. We're here all the time, pretty much. But use the live chat function, drop us an email. All the contact bits are on the website. If you're not sure how hard or how abrasive your toothpaste is, go and have a look on the toothpaste bit of the website. I'll put the links up in the comments box underneath here. But other than that, that is my lot for this evening. I will be around on all the social media platforms next week. I'm not having a face-to-face. You don't need to see my face every week, thank goodness, I'm sure you say. And until then, look after yourselves, look after each other, and don't forget to brush your teeth before you go to bed tonight. Best brushing buddy, spit out, don't rinse. And I'll see you all soon. Thanks for joining me. Bye.